Intravitreal injections means injection into the vitreous of the eye. This may be a course of anti-VEGF injections. Patients with several retinal conditions such as wet AMD, macular edema from diabetes or vein occlusion can lose their central vision when abnormal blood vessels bleed or fluid accumulates under the retina in the back of the eye. A series of injections with anti-VEGF may be given into the back of the eye to stop blood vessels from growing and thereby controlling the fluid leakage. This treatment has been in use over the last decade and is known to be highly effective in preserving central vision in many people. Who should not be treated with anti-VEGF? Anti-VEGF therapy should not be given to patients with the following: allergy to anti-VEGF or any of its ingredients, an infection in or around either eye or severe infection anywhere in your body. Anti-VEGF should be used with caution in patients who have had a heart attack or stroke in the last 3 months, or who have uncontrolled angina or uncontrolled high blood pressure. Latest studies have shown that the risk of anti-VEGF to stroke or heart attack is very small, theoretical risk. There is little evidence of use in pregnancy, so patients who are intending to start a family would need careful discussion. How does an anti-VEGF injection prevent sight loss? Anti-VEGF therapy stops abnormal blood vessels growing, thereby stopping the leak and bleeding beneath the retina or macula. This prevents or limits damage to the retinal light receptors and loss of central vision. Anti-VEGF are very effective in preventing further central vision loss in up to 90% of treated eyes. How is the treatment given? The treatment is given in an outpatient setting in a sterilized environment. The drug is injected into your eye using a fine needle. Minimal discomfort is to be expected. The entire procedure takes approximately 5 to 7 minutes, but the injection itself is over in less than 20 seconds. The injection is given with you lying down comfortably on the couch. Local or topical anesthetic drops will first be applied to numb your eyelids, and surface of the eye are cleaned to prevent infection. Your face and the area around your eye will be covered by a small surgical sheet to keep the area sterile. A small clip, speculum, will be used to keep the eye open. The injection site is marked with calipers and your eye is stabilized with forceps or a cotton bud. What are the risks with these injections? As with any medical procedure, there is a small risk of complications following anti-VEGF treatment. Most complications that might occur are from the injection itself, rather than the drug. For the majority of patients, the benefit of the treatment outweighs the small risks from injection. Some common side effects that could occur include subconjunctival hemorrhage at injection site which clears in a week or 2, floaters, sore and gritty eye, corneal abrasion. Rare risks of injections: serious eye infection, 1 in 2,000 cases, detached retina, increased eye pressure, bleeding in the eye, inflammation inside the eye and cataract. There are no special precautions following intravitreal injections and you will be able to travel, but please avoid getting water into your eye or swimming for the first few days afterwards. You will be able to go home shortly after the treatment. You will go home with lubricating drops which will provide some comfort after the injection. Use them as often as necessary. Many patients require a loading course of 3 or 4 injections at regular intervals of 4 weeks. We usually ask that you monitor for the symptoms of complications, which will include severe pain, redness, or vision loss, and ask that you contact our clinic urgently or attend your local A&E should this happen.